Hello everyone, we are going to start oral pathology first chapter, developmental defect of oral and maxillofacial region. In this we are going to start first with cleft lip. So what is cleft lip? It is defective fusion of medial nasal process with the maxillary process, and this will lead to cleft lip. Okay, cleft lip usually occurs in 4th to 6th week of a fetal life. Okay, and what is cleft palate? Cleft palate, when there is a failure of fusion of palatal shelf, it will lead to cleft palate. Okay, now what are the occurrence of cleft lip and cleft palate? And sometimes they occur both together. So cleft lip alone, 25% of the cases you can find cleft lip alone, and male it is more common than female. Cleft lip plus cleft palate, it is more common in male than in female, and you can find 45% of the cases. Cleft palate alone, 30% of the cases you can find this, and in this female are more common, and it is more common in female than in male. Okay, so now there are different beside cleft lip and palate, there are few different cleft also. These are lateral facial cleft. Okay, lateral facial cleft, it is due to the lack of fusion of maxillary and mandibular process. Okay, there's a lack of the fusion of maxillary and mandibular process. Then comes oblique facial cleft. Oblique facial cleft is because of the failure of fusion of lateral nasal process and maxillary process. And then the third one is medial cleft of upper lip. It is because of the failure of fusion of medial nasal process. And last is medial maxillary anterior alveolar cleft. It is because it is a bony defect, okay, in the midline of maxilla between central incisors. Now I'm going to show the pictures of all these things. See, this is the picture of a cleft lip patient. See, this is medial maxillary anterior alveolar cleft. Okay, see, medial maxillary anterior alveolar cleft. This is the picture. Okay, this is the picture, and as you can see that there is a bone defect in the midline of the maxillary and between the central incisors. Okay, this is, see the picture, this is lateral facial cleft, and this occurs when there is a lack of fusion between the maxillary and the mandibular process. Okay, and one more thing, it is also associated with one disorder. It is also associated with one disorder, that is mandibulofacial dystosis. We are going to read about this later. Okay, so this is the picture of lateral facial cleft. Now you can see this is median cleft of upper lip. See, this is median cleft of upper lip. This is because of the failure of fusion of medial nasal process. Okay, and yes, you can see this is an oblique facial cleft because of the failure of fusion of lateral nasal process and maxillary process. Okay, so these are different type of facial cleft. Okay, now what about palate? We have as we have read about it that cleft palate because of the fusion of palatal shelf. When does it occur? It occur between 8th and 12th week. Okay, between 8th and 12th week. Okay, so there are different classifications of palate. This is this is the classification of a palate. We knew class 1 cleft palate, in which they involve only soft palate. In class 2 cleft palate, they involve soft and hard palate both. In class 3, soft palate, hard palate and lip, but it is an isolated lesion. And in class 4, soft palate, hard palate, then lip, but it is bilateral. It is isolated, it is bilateral. So this is the classification of a palate, and there are few genes associated with this. It is MSX1, FGF, FGFR1, TGF3, IGF6. You should know about this. Just revise 1 or 2 times, because they can ask which is the gene associated with this. One more thing, they can ask that if it is a unilateral cleft lip, it occur on which side. So 70% of unilateral cleft lip occur on left side. Now there one more thing, complete cleft lip and incomplete. If it is complete, then it is extend into the nostril, and if it is incomplete, it does not involve the nostril. So these are the cleft lip, cleft palate, and the other facial cleft. So now we are going to read about lipids. So in lipids, see, this is the diagram of a lipids. I'm showing you from book only. Lipids, small mucosal invagination that occur at the corner of the mouth. See, you can see that occur at the corner of the mouth on the mammalian border. And why it happened? It happened because the failure of normal fusion of embryonal, maxillary and mandibular process. So this is about the lipid, but don't get confused with commercial lipids and paramedian lipids. In commercial lipids, it will occur at the corner of the mouth. And but the paramedian lipids will occur, see, they will occur on the lower lip. You are able to see the picture. So so this is one different, and the other different is that in paramedian lipids, they do not associate it like I'm so sorry, in commercial lipids, they are not associated with facial and palatal cleft, but you can see facial and palatal cleft in paramedial lipids. So this is the paramedial lipids. It is a rare congenital invagination of lower lip. It arises because of resist lateral sulci on embryonic mandibular arch. One more important thing in this paramedial lipid is it is autosomal dominant. It is autosomal dominant and is a combination of cleft lip and palate. One syndrome is associated with it, that is Van der Waals syndrome. And the gene associated with this, you can say that there is a microdeletion of chromosomes band IQ32 or Q41. One more gene associated with this is 17p11. One more important point is in this Van der Waals syndrome, you can see synethia. What is synethia? It is a congenital band connecting the upper and the lower jaw. Okay, so in this topic we have read about cleft palate and the different facial cleft, commercial lip pits, paramedian lip pits, and now we are going to read about double lip. Yes, now we are going to read about double lip. Okay, it is a cupid bow shape. Okay, it is a cupid bow shape. It is there will be fold of the tissue of mucosal side of the lip. Okay, yes. You can see there is a fold of the upper lip and it looks like a cupid bow shape. Okay, it is most often congenital in nature. Okay, but it can be acquired later also. Okay, and when it is believed to arise when it is acquired, when this double lip is acquired, it may be the component of Escher syndrome. Now the characteristics of Escher syndromes are: first is double lip, second one is blepharochalysis, and the third one is non-toxic thyroid enlargement. Okay, so this is the picture of double lip, and this is the picture of Escher syndrome, which is related to the double lip. Okay, in this the person is not able to open his eye because there is the edema of the upper eyelid. Okay, so this is all about double lip. Okay, in next video I'm going to tell about Persis granules and about tongue, development defect of tongue. Thank you.